Bunions. What are they? If you have a bump on the side of your foot just below the big toe, chances are you have a bunion. But don't be distressed by this diagnosis. We have very effective treatments at helping resolve this condition. You may ask, what caused this bunion? Well, there's usually two parts to that question. First, there's a hereditary component. You're a victim of genetics. You can blame your mother and father. There's also an environmental component where sometimes your activities and shoe wear can contribute to its development, but genetics probably plays the biggest role. In terms of what we can do to resolve the symptoms that patients often have with bunions, well, we first start out with recommending a wider shoebox, different types of pads. Sometimes we can give a local injection. But if the pain persists and interferes with your activity, the shoes you want to wear, and really starts to limit the things you like to do on a daily basis, then surgery may be an option for you. In our office, we use some of the most advanced techniques to help resolve the bunion deformity. This is a structural deformity, and the toe and the bone often need to be placed back into their proper alignment. We use a TightRope procedure often to resolve the condition, and this involves correcting the bunion without having to actually break the bone. Sometimes the bone has to be moved into its corrected position via an osteotomy or surgical fracture. And the main thing is that we do it in a fashion that will resolve your condition long term. We use surgical techniques to hide the scars and to try to minimize any scarring that you might have on your foot. If you think you're at the point where your bunion is limiting your activities, give us a call so we can help you resolve this condition.